on this episode of A Tale of Two Hygienists.
We do a neuroinfinity stress response evaluation. So we're checking into brainwave activity, heart rate variability, breath response, skin conductance, all these different parameters, and running people through a stress and de-stress test to see how their brain and body are communicating with each other and how that's showing up in their system overall.
Fascia is one piece of connective tissue that coats everything in our body. So all of our organs, muscles, bones, nerve fibers, all the way from the tongue to the tips of our toes.
We have this kind of thing in chiropractic where we say, like, no part of your body operates in isolation. So no one thing does its own, it's only doing that. Like, there's all this cascade effect that happens, and that's where different practitioners come into play to help support that whole unit, that whole body.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 424. I'm your host, Andrea Johnston, and thank you so much for joining us today. I just want to say before we get into this, a very, very sincere thank you for everyone that we ran into at Chicago Midwinter, people that spent time with us. Absolutely a ton of fun. Probably the best midwinter that we've had probably in quite some time. The weather, of course, was crazy weird with 70 degrees one day and then like 32, 33 degrees and snowing a couple days later. I had the greatest time hanging out with Heidi and Leslie. They absolutely killed it with their networking skills. I've never seen two people just be so natural about meeting people and hanging out with people. And so that was really fun. And I can't remember if I've given Michelle Lee a shout out, a thank you shout out already, but a big thanks to her for connecting Heidi and Leslie and myself, getting them on the podcast, and just kind of showcasing all that they have to offer and giving you guys episodes that you're enjoying. And how do I know that you're enjoying them? Because I've seen the download numbers, everyone, and they are absolutely telling. So I know you guys are liking them. In this episode, sadly, the last episode of the Myofunctional Therapy series, Heidi and Leslie brought along a guest, their colleague, Dr. Andrea Smith. Dr. Smith is a chiropractor who has learned ways to work with myofunctional therapists to get the best results for their patients. And on her end, she has some very interesting methods that she uses to assess and diagnose issues. I can't wait for you to hear it. And like always, if you are interested in this, if you like this, please make sure you reach out to Heidi and Leslie and Dr. Smith if you have any questions or thoughts about anything they mentioned in the episode, or simply to tell them, hey, come back on the show. It was awesome. I would love to have them back on if you all want them to come back on. So let me know about that. Next week, we have an episode with Kim Augustus about life after hygiene school. It's a pivotal episode, I think, especially for new grads. So make sure that you share it with your fellow new grads if you're a new grad listening to this, or maybe you're an established hygienist and you have a new grad that's starting in your office or has been working in your office recently. Please share this episode with them. I think that they need all the support that they can get. We talk about what the workplace is really like, mentorship, things that Kim does to kind of help them with that transition into practice. So make sure you come back for that one. The coming weeks, we also have some really strong episodes from just a wide variety of guests and on a variety of topics as well. Make sure you're hitting that follow button on Apple Podcasts, and then it's a subscribe button on other podcast outlets. If you have any suggestions for topics or guests, please let me know. Andrew at A Tale of Two Hygienists. Thank you so much. I hope you enjoy this episode, and have a great week, everyone.
A tale of two hygienists.
Welcome, everyone, into the interview portion of the podcast. Really excited today. This is going to be a little bit different. So this is part 4 of our Myofunctional Therapy series. I'm joined today again by Leslie and Heidi, but we're doing something different. I don't know that this has happened, maybe in the sequence of like when we actually release all these things. This hasn't happened before, where not only do I have like co-hosts kind of with you two today, but you guys are now also interviewing. So I'm going to pretty much just sit back and relax is kind of what this is. It's a takeover of a takeover, and I love this. Thank you both so much for being here again with me.
Thank you for having us.
Thank you for having us.
All right, we have a special guest today. You guys brought on a special guest. It's really cool. Heidi, do you want to introduce her?
Love to. So we have Dr. Andrea Smith, and she is a neurologically based chiropractor, but I don't want to mess any of this up, Dr. Andrea. So I would like you to tell everyone kind of what you do and your specialty, and then we can kind of go in on how we met.
Okay. Hi, everybody. Dr. Andrea Smith. I'm with Synaptic Chiropractic. We're over in Westbrook, Maine. So the chiropractic is so incredible and so amazing. And there's over 300 different techniques and ways to adjust the spine and what we do. I tend to focus more on the stress response system of the body. So that fight or flight, sympathetic and parasympathetic responses in the body. So what I do in my office is actually, it's pretty amazing and I love it so much. But we do a neuroinfinity stress response evaluation. So we're checking into brainwave activity, heart rate variability, breath response, skin conductance, all these different parameters, and running people through a stress and de-stress test to see how their brain and body are communicating with each other and how that's showing up in their system overall as far as metabolic and musculoskeletal health. So we take those scans, we work within the adjustment within the specialty that I have, which is chiropractic, to adjust the spine to create a better brain-body communication pathway. So that's what I do in my office.
She's absolutely amazing.
This is a real thing.
Yes.
I don't even know where to go. This is beyond what I thought, by the way, that you guys your special guest is going to be talking about.
She's amazing.
Yeah. Okay. Well, let me process this for a minute. I want you guys to talk about how you guys met, but I'm going to have I have questions.
Okay.
So I met Dr. Andrea through my study group. One of the members of my study group brought Dr. Andrea in, and I was so excited to work with her because, again, my pathway with sleep and breathing really took me down the route of our autonomic nervous system because I struggled with anxiety. And so a big thing that I like to do when I work with medical professionals is really find out how they practice so I can better help my patients, because one thing might be better for one patient than another. So I asked Dr. Andrea if we want to exchange services, and we started working together. And she put me through her whole process, which was absolutely amazing. I mean, I've been to a bunch of different chiropractors. When you're a dental hygienist, I mean, you get a lot of body work done. And it was like nothing I'd ever been to before. I mean, she hooks you up to, all these sensors and puts you through these, I don't know what you call it, Dr. Andrea, like stressors, right?
Yeah.
And you see how your brain waves react.
Yep. Yeah. So we put you through basically like a cognitive challenge, a sound challenge, a physical breathing challenge. And then in between those periods, we rest the body. So allowing the body to kind of go in and out of sympathetic and parasympathetic, hopefully in a beautiful way, is what we want to see. We hope to see. I hope to see all these scans come up the first one and I'm like, oh my gosh, this is amazing. Your brain and body are communicating beautifully. But normally with like physical, chemical, and emotional stressors that our body takes in, there's some areas of either, I hate to call them concerns, but they're just opportunities for healing in the body. So it's the body's presenting with and the brain and body communication is presenting with these issues. And we go in and, from my standpoint, adjust the spine to help work on those issues. But yeah, we're stressing the body and then relaxing the body. And it's really cool to see how it communicates in that way.
And you get a report.
Yeah. You get a full report. So you get to see everything that we did and we go through and explain it. So yeah.
Is this a relatively new science, or is this something that's been done for
No, there's a diploma in chiropractic neurology, which I do not have. So I do not claim that I'm a chiropractic neurologist in any way. But the technology that I do is the NeuroInfinity, has been around for several years. So it's been around. It's just that you'll go to every chiropractor is totally different. You'll see 10 on a road and every single one of them is going to practice differently. It's more just about finding the person that resonates with you. And so, so this technology has been around for a little while. So not necessarily new, but maybe just not as common as we would like it to be.
Can you talk a little bit about like the I would say the different parts of the body and how they communicate with each other. For example, like, we're talking very specifically kind of head and neck within dentistry.
Yep.
So what you do throughout the rest of the body, how does that impact what like a myofunctional therapist would be doing for adjustments?
Yeah, so that's actually really cool. And where actually Heidi, because I didn't know, I knew about myofunctional therapy. I had a basic understanding about tongue ties, lip ties, things like that. But where I was invited by Dr. Phil Finemore to come to the study group that Heidi was running, and I met her, and she got to sit down with me and explain like what the deeper meaning behind myofunctional therapy and tongue ties and where that can go as far as the fascial system and the communication with the fascial system and the nervous system. And it just kind of blew my mind because, we all know anatomy. We've all studied anatomy, physiology. We know the basic mechanisms of the body, but just knowing, and then from a personal standpoint, how the tongue tie affects the jaw position, how the jaw position communicates with the cranial system, how the cranial then communicates with the cervical, and then the cascade effect down. But you don't know until you've had a myofunctional therapist explain it to you from their understanding. So that's where like Heidi's been instrumental, and even in my own care, because going in through her program has been pretty phenomenal for myself as well.
Do you find that this is more like a kind of like a bi-directional relationship? Like what you do will impact kind of what Heidi does, and then then it goes the other direction as well, right? So like as she's adjusting and fixing things, then it kind of helps on the other end.
100%. So actually, I was noticing once Heidi and I worked together, and then we were doing more cross referrals of patients, I was finding that patients were like, we had gotten to a certain level in their care. And I'm pretty open and honest with my patients. Like if what we're doing in our office isn't getting you to where I think you can get to as far as a positive trajectory, I'm going to help find you a practitioner where I think you're going to just really go above and beyond. And for some of my patients, that's been referring to a myofunctional therapist, either Heidi or Leslie, because these people have tongue ties that are affecting the position of their jaw, that are affecting their sleep. So no matter what I do within their nervous system, I'm only going to be able to take them so far, because the actual physical body needs to have care done to it. It needs that myofunctional therapy. It either needs a tongue tie release or a lip tie release. So yeah, it's become a very interesting symbiotic relationship. And then where I've had patients come from Heidi and I've done their scans, and they're at there's a level where people get to, like, I have people come in at like, basically if you thought about it, it's like at a zero, like their system's tanked, they're nervous, they're in sympathetic fight or flight all the time. Yeah. And then, but most of Heidi's patients or Leslie's patients that I see or work with are already in the middle ground. Like they are already at a better starting off point to allow the body to continue to heal. So it's been really interesting to see.
Can we talk a little bit? So I'm hijacking this whole interview. I'm really sorry. We're getting to the business thing. I have so much.
You said we were getting to host today. I haven't asked.
I'm sorry. I will be done in like 5 minutes. I promise. Well, I can't promise that.
I'm just.
So okay. So I want to talk about these scans a little bit more. So, because fight or flight is like, it serves a purpose. People want, now you need to have that response. And so there has to be like the ability to fire into it, right? And then fire out of it and relax and do the thing. So when you're doing these scans, is there also a level of being within that fight or flight? Like you're 100% like you run through walls, and then they're like, oh, you're not firing the way you need to be. Like, what are you measuring exactly?
Definitely. So what we're checking into is the brain waves that we look into, because there's 4 that I can look into, because I'm not doing a sleep study on you. I'm not getting you into deeper brain waves to sleep. So we check into beta, alpha, SMR, and theta brainwaves activity, as well as heart rate variability, temperature response, skin conductance, so the sweatiness, clamminess of your hands or dryness of your hands when you're in certain areas, and then a breath response belt is put on you. So we're checking into how many breaths per minute you're doing during certain situations. So within that, we get to see how beta goes up when you're stressed, which is what it should be doing. That's a positive response. Mm-hmm. But how we should be able to come out of that when the perceived threat is gone. So not that it's not still working, not that it's not still going, but it's not at the level that you would have at a stressful response. And then also seeing if people, because there are people that function more, for lack of a better, for keeping it on the simple end, I guess, is saying they're too parasympathetic. So their body isn't achieving that fight or flight response that they need to have, when we perceive a threat, we need to know how to get out of that situation or fight, flight. But then there's people who are more parasympathetic who are freezing and locking down and going more inwards. So it's interesting to see, because we all I'm trying to, before I do a scan, I'm like, oh, I wonder where this patient's going to be. Like, I think it's going to be here. I am often surprised. So where people are at. And within that stress response with people, you go down a whole rabbit hole because of the nervous system is the master computer. It's the control. It controls and coordinates every other system in the body. So then you're looking into people who are, if they're too sympathetic, are they getting sicker often? Are they having more muscle tension, more jaw tension, more clenching, things like that? And that's where Heidi and Leslie come in beautifully for that portion of it. So
the tests that you're running to simulate a stress, are these like the heart test, like go run on a treadmill, or I'm going to watch a scary movie, or like how are you? I mean, is it really just electrical impulses and that's it? Or
well, so what it is everybody's favorite. So we run through the test. One is a math challenge. So I'm having you do a subtraction challenge during.
I failed.
Yeah, and it's
definitely wrong about one.
It's not about failing. It's just about trying. It's just about trying. So one is a little bit of a math challenge, and then we relax the system. The one is noises. So it's different noises, one of them being a dentist drill and certain things to see how those sounds affect the body. And then the other one is a breathing challenge that we have people do while seated with their eyes open. So not closing their eyes and going inward to a meditative breath, but more opening the eyes and trying to focus on diaphragmatic breathing, more of that belly breathing response, and then relaxing the system in it. So we're stressing the brain and the body in 3 separate ways because the body's senses are what are feeding that brain-body communication. So,
all right, this is my last in my head written down question. So I want to talk about the network of other professionals that you work with, because it's really big in dentistry, or it should be. Maybe not every office is great about it, but we have kind of within the dental practice, we have oral surgeon, periodontist. We have different people that we refer to, and then when it comes to bigger complicated medical issues that we might come across, and sometimes we have a referral network or not, or sometimes we don't. Tell me more about what you've learned about the dental profession in general, because I'm sure Leslie and Heidi have probably kind of set the stage of we have awesome dental people in this world, but I'm sure you've run into other people, dentists and maybe some surgeons and things like that in the dental field.
Yeah, I've actually had really beautiful, I guess, relationships with dentists since I've started in chiropractic, which I think has been, maybe not the norm. I'm not sure, but especially because I've had clients and patients who are dentists who, come in mostly for, pain management and things like that. And then we get to delve a little deeper into their stress worlds, because the extremely high stress profession from what I've encountered. So, and then working with Heidi and Leslie has just been so lovely and amazing. But I think it's a underexplored referral based situation. Because I don't know about Heidi. Heidi could probably speak to this, or Leslie can speak to this. When you have patients that are under chiropractic care while they're going either through your program or working with the dentists that you have worked with, have you guys seen more positive results and different situations and things like that? But I really think it's an underutilized referral relationship. And it's lovely. I've had great dentists to work with. I mean, everybody's human. I've seen ones that don't really want to work with chiropractors, which is, everybody's option, but we're here to create that relationship.
Heidi and Leslie, are you guys seeing kind of that, that other side of that coin? People who are under the care have better results?
Absolutely. Without question. Yeah. I feel like Dr. Andrea is someone that I refer to quite a bit in my field with what I do with myofunctional therapy, just because most people are in fight or flight more because their sleep cycles are off. And even the ones who sometimes I'll have a client and they've really fooled me. I'm like, wow, this person, it seems like really calm. And then it comes out, through the sessions, like, no, I'm so high anxiety and so stressed out. And I'm like, really, wow, you hit it really well. So I've come to realize like this is actually, again, for my sessions, it's something I actually start off with right away. I send them a self-awareness check-in, and I want them to really get real with themselves and like, how are they feeling about themselves? Like Dr. Andrea and I, work with one patient that she had referred to me who has had migraines since she was 5 years old. And they think that she had them actually from infancy. And she has gone to all these different doctors and neurologists and really, loves Dr. Andrea. And Dr. Andrea had referred her to me. And this woman really didn't have a lot of hope. Like, I mean, I asked her what her goals were with working for me, which I do with every single patient. And she's like, well, if your therapy could just get me a little bit of relief, and I was like, well, that's very limiting belief. I said, and I really want my clients to set high standards for themselves, high goals. I want you to get rid of your headaches. And that's where I want her to focus on. And then I want her, she feels a lot of a burden to her family. She can't work, she can't go to her kids' functions and stuff. And so we focus on those goals. Like, how can we get you to accomplish those goals? And before my first session with her, I didn't even do anything with myofunctional therapy. We just kind of talked about that, how to really focus on her thoughts and her mindset. And I mean, the next time I saw her, she was already having a decrease and not in the headaches and the amount of time she had to take, her prescription medications, and just honestly, sometimes giving permission to go take a nap and like relax. I think we live in a world where we feel so guilty about everything. Even with my clients and exercises, it's like, we're human. We're going to not, be great sometimes with the exercises. That's okay. This whole program is designed for our patients to be successful. So there's no timeline of when that is. It's what they have to go at the pace that makes sense for them, and their family. So working with Dr. Andrea has just been amazing. I mean, we've seen such good results, like with mutual patients. So
that's awesome. I mean, and that's what it's all about. I mean, at the end of the day, like healthcare probably needs to collaborate a little bit better, a little bit closer, so that we can have those results. Because if we're so siloed that we're never going to get the results for our patients that we want. We don't know everything there is to know about medicine, and no one can. I know I derailed us really far off of our topic thing here, but we're supposed to be talking about adults. We're supposed to be talking about kind of like the last stage of the 4-part series. One of the biggest issues that we kind of joked around, but also didn't joke around because it's also true, is like sleep, like me and my sleep, and then everyone else. Like sleep seems to be such a problem for adults. Like we don't get quality sleep, we don't get adequate, we don't get quantity sleep, we don't get anything of sleep. So can we start talking a little bit about that and kind of its impact there?
I would love to jump in from a personal standpoint with relating it back to like myofunctional, like the women in my family pride themselves on not sleeping. It's almost become like a badge of honor. Like when we're at a holiday function, like who's going to wake up the earliest because they slept the least to get to the coffee pot first. Like that's almost become a conversation in my family. And I didn't realize until I went to chiropractic school and then started learning more about sleep. Like, I mean, we all know sleep. We feel better when we sleep more, but I didn't know how that affected your health down the road in such a dramatic way if you're not getting enough quality sleep. Like you can sleep for 8 hours, but if it's not quality sleep, like it's not good sleep. So, And then when I got married and my husband had recorded me like once or twice breathing with my mouth open so loudly that he recorded it because he thought it was funny and showed it to me. And I was mortified, but I was also like, have I been doing that this whole time? And that's actually right around the time that I met Heidi and Leslie. And we did the they had started this beautiful study group, and I had come into it, and they did an assessment on me, and they're like, well, you have a tongue tie. And I'm like, what? Like, don't just babies have tongue ties? Like, what are you talking about? Adults have tongue ties. It could be affecting me. And then once I went through Heidi's program, and then I had a tongue tie release that was really successful, and then doing the myofunctional therapy after that, continuing to do that, my sleep has improved like drastically. I'm no longer part of the competition in my family to who has the worst sleep, like, which is lovely. I'm happy to be out of that competition. And it's allowed me to now look at my patients, my adult patients, differently. And like now, because they've taught us the basic assessment on what we need to look at in our practice and what I'm looking for to refer to them. And there's been people where I'm like, whoa, like, wow, like it's mind blowing. So the sleep portion of having my tongue tie release and going through myofunctional therapy, I sleep better and more consistently. And because of that, my moods have improved where I'm less quick to like trigger to an emotional response, which has been, it's life-changing. It can be a really intense experience to once your body gets into that more parasympathetic function a little bit more. It's like, oh, okay, this is lovely. So that's my personal story with it. And it's pretty awesome. And I've seen it in my practice too with my patients that have gone through the myofunctional stuff with Leslie and with Heidi, like just their sleep improvement that they don't even really recognize right away, like, which is really awesome. So
I think a lot of times people, especially adults, they're afraid of having that tongue tie release. Can you talk a little bit about, I mean, you're a healthcare professional, you probably saw like the value differently than probably what our patients are seeing.
Yeah.
But like, how would you, from your standpoint, kind of encourage someone to get that done?
So I would say if you need it, do it. I mean, I don't give advice to people I've never treated before, obviously. Like, let me just put that out there. Yeah. But as far from my personal experience, having it done was, I mean, I explained, because Heidi's great. She like asked me like a week later, she was like, okay, so what do you notice that's different? And I was like, well, physically, like not much has changed. And right as I was talking to her, I have this habit of like reaching to the back of my neck because I always had this spot right on the base of my occiput that's just like always tender. And when I was talking to her, I was like, what? Like, that's gone. Like, I was like, wait a second. Like, that's gone. And I mean, I've had everything. I've been adjusted, massaged, any body work, because I love body work. It's all amazing. Mm-hmm. But I've had everything done, and that spot's always been there to the point where I just forgot. I forgot that it was there. And then having it done and telling Heidi that, like, I was just like, oh my God. So the tongue tie release for me, just like, is it a process to go through? Yeah, it's a procedure. Like, there's going to be some uncomfortable periods with it. There's going to be some work you have to do afterwards, which I can't stress enough. But for me, it just created way less tension on my occipital ridge, which was beautiful. My tongue sat, even though I'd done myofunctional, my tongue was already sitting way better. It just helped me achieve that little bit more, which was like, made it more easeful for my tongue to do that. So I would tell people that from my personal standpoint, it really helped me, but everybody's got to make their own choice with that. And I'm also not super, like, the dentist and oral stuff, like, doesn't really make me nervous. So I don't have that anxiety around it.
I wanted to kind of expand on that too, Dr. Andrea, because, Dr. Andrea, like, was one of the 50% of people when they have a tongue tie release will experience releases of the fascia or tightness in other areas of the body. And this is one thing that I just find so fascinating is the fascia. And, I had an experience with fascia when I was pregnant. I didn't know much about it, but I was in a lot of pain. I was told at 5.5 months along, I should probably go on bed rest because they weren't able to like fix what was going on. And I was like, that's not an option. So I went and saw a physical therapist who specialized in fascia, which I knew nothing about at the time. And they showed me how my fascia was like bald in one area of my back. And it was creating, my gait was off by over an inch. My hips were rotated. And it was creating this tightness in my hips. And when they fixed that, I remember thinking, oh my word, I want anyone who deals with fascia, I just want to know about because that was amazing. Not knowing, fast forward, that I was going to be working with the start of all fascia in our body is our tongue. And, fascia is one piece of connective tissue that coats everything in our body. So all of our organs, muscles, bones, nerve fibers, all the way from the tongue to the tips of our toes. And so when you see little kids running around on their tiptoes, there's a possibility that they have a tongue tie. And 50% of people, when they have a tongue tie release, will experience either immediately or within like usually the first couple of weeks, a release in other areas. Now, I had a knot in my shoulder from, almost 20 years, I would say. It was the size of a golf ball. And I hadn't practiced clinical hygiene for a couple of years, and I'd been working with a lot of people. And when it was really bad, when I was practicing hygiene, I could look over my left shoulder and I would get electrical currents kind of going down my neck. And I had gotten to a point where the pain level was a 1 or 2, but it was always there. And so I just thought that that's where I was going to end up, like a burning sensation in my shoulder. When I had my release done, I didn't get the immediate release in the chair, which I have seen. I've been live where people have experienced releases, and it can be emotional. I've had, people start crying in the chair when they had a release because they felt, one of them had a foot injury and they felt it go all the way down to that foot. And so I was kind of bummed. I was like, oh man, I didn't get it. I wasn't. And a week or so later, I'm like noticing, I'm like, wow, I don't notice, that pain. And when I went to touch it, the bump was still there. So I was like, oh, it's probably going to come back. I had body work done. I do recommend any of my patients when we do a release have body work before and after. And it has completely gone away now. So it's pretty amazing.
I was going to say, I feel like with touching on all of that and kind of like the responses to the body aspect that both Dr. Andrea and Heidi kind of got from it is what we often see with the patients that are willing to also pair this with not just doing myofunctional therapy, but realizing that there's a bigger connection to this and the entire body too. So I think that's where Heidi and I too in our practice with the study group and Dr. Andrea has changed so much on realizing that it's not just what we do. We're just one piece of that puzzle. And so connecting it with the right provider from a bodywork standpoint as well really helps those patients kind of see more full body benefits from these type of procedures.
Yeah. And because I totally agree with it. And like, we have this kind of thing in chiropractic where we say like no part of your body operates in isolation. So no one thing does its own, it's only doing that. Like there's all this cascade effect that happens. And that's where different practitioners come into play to help support that whole unit, that whole body. So we can't be everything for our patients. We can't be all of the things for them. So it's beautiful that we have this incredible network, at least here in Maine, with this study group that we have, because it's allowed me to just open up my brain and open up my mind because of what Heidi and Leslie have brought to the table. So,
well, kind of piggybacking off of that, Doctor, like I want to talk about TMJ kind of as our last topic of discussion. I know I told you this is going to go by way too fast, but it is something that I've had some chiropractic work done in the years past, and they actually did kind of work a little bit, in which I didn't know that was something that my chiropractor would do. It's like open wide. I'm like, okay. And so I'm like, all right, I work in the dental, wait, all right, wrong office. Anyways, so I want to talk about, like, from both of your perspectives, what are we seeing, some of the causes, some of the therapies that we're doing to treat and help with TMJ issues?
So part of sometimes the jaw pain and the TMD disorders can be that your jaw is unstable, at nighttime. So I wore a night guard for 20 years and I was a severe grinder clencher. And I was so some people that we see in our chair, Andrea, as you know, as a hygienist, you can see that they're grinding their teeth horribly and they have no symptoms. Like, no, I don't think I grind. Like, I don't have any symptoms, no headache. I was the exact opposite. I did not have a lot of wear, but I had tension headaches going down the back of my neck every single day. I had jaw pain, and that was wearing a night guard. If I didn't wear my night guard, it was a lot worse. And so we have to be careful with night guards because, again, they are, yes, going to protect the biting surfaces of the teeth, but they are taking up more tongue space. The real issue, the underlying issue can be that your tongue is not stabilizing your jaw. Your tongue, when it's softly glued to the roof of your mouth and your mouth is closed, your jaw is stabilized. But if your mouth is open or your tongue is low and it's obstructing that airway, your body goes into that fight or flight response, and your body is willing to destroy the strongest thing in your body is enamel. It's willing to destroy that enamel to move that tongue position out of the way. And so that is what happens with a lot of the clenching and grinding, mine in particular. When I stabilized my jaw and got my mouth closed, I could get rid of my night guard, which I will tell you, I was actually really scared. I didn't really know if it really was going to be okay, because again, my senses were I was in a lot of pain and headaches and stuff on a daily basis. And I haven't worn a night guard for, I think, almost a year now, and so it's been life-changing, for me.
And to touch on that too, of like when patients wear night guards, like we often explain to them, now there's something between your teeth, right? That's protecting that enamel on your teeth. So we're not going to see the damage anymore. But often we're not looking at, well, why do we need this between our teeth in the first place, right? Like, what are those muscles doing? What's happening to the airway while we're sleeping? And so, that's often what, obviously we love when dental offices, the dental hygienists are screening for these things. But when Heidi and I, talk about with patients and their tongue posture and getting that tongue, like Heidi was mentioning, kind of softly glued up onto the roof of the mouth, that's now pulling that tongue and stabilizing it more up and forward out of the airway so that it's not going to drop back with that lower tone of the tongue and collapsing in on how much airway space we have there, which again, when our body goes into kind of clenching and grinding, often that's our body, our body's protective. It's going to protect us and make sure that we can get air while we're sleeping. So if it's clenching, because when we squeeze our teeth together, we activate more of those pharyngeal muscles and kind of stent things open to allow more oxygen in there. Or if we're jetting that lower jaw in different positions forward to bring tissue forward and help open up that airway, like our body's doing different things all night long to kind of make sure that we're getting oxygen. We need to breathe. So that's a, big component of it. And then obviously how that trickles into what's happening to the muscles, the retrusive pressures that go into the jaw joint when that's being done all night long. There's so many of these kind of things that correlate to that.
And then from a chiropractic standpoint, the way I personally, and other chiropractors may look at this differently, or their technique might be a little more focused. I'm focusing on the cervical curve in the spine and how that's affecting the position of the head and what that's causing the jaw to do over time. So that malposition of the jaw. So if we have a loss of we have that natural, beautiful cervical curve that creates that beautiful support for our neck. But as we engage in more technology or more forward head posture or just tension because of maybe a tongue tie or some other dysfunction in the body, and we start to lose that beautiful curve and it becomes straight or even reversed, that's causing the head to sit forward over the shoulders, which then causes the jaw to have a malposition, putting tension on those muscles, putting tension on that fascia that is within that system as well, causing all of this dysfunction. And what we look as chiropractors, we look at that curve and we're like, okay, how can I help support and hopefully bring back a little bit of this curve or decrease that muscular tension to help pull that back, creating less stress and tension in the system. So that's where I would come in and look at it just a little bit differently, but it all supports what they're doing.
So how many throughout, like, let's say someone specifically has like a TMJ issue, they go see Heidi or Leslie first, then they get referred to doctor. Like, how long is that process of rehabilitation in correcting? Like, what's the expected time frame for that?
Oh, that's such a tricky question.
You're welcome.
So, I mean, obviously, like I can give like a ballpark figure. So, but it is about the patient compliance and patient care that they do outside of my office as well. And also what they're doing with Heidi and Leslie. I would say we all know, and you guys probably know through the work that you've done, symptoms resolve first. So pain usually goes away first, but does that mean that the problem's actually solved? So does that mean the correction has been fully made just because the symptom has gone away? Usually not, no. Because if they were encountered with a stressful situation again, either physical, chemical, or emotional, would that come back right away? Has that adaptability been created in the system? So I would say people are generally, you're in my office, like for your first round is 13 visits. So we do 13 visits and then we do a full re-exam and rescan, like our Neuroinfinity, we do a rescan to see what has happened, what changes have been made in the body. And then I recommend care after that. And I always tell everybody my whole goal, even though most of my patients are incredible, I'd love to hang out with them all the time. But my whole goal is to see them less and less. And get to a point where they're basically on a maintenance program where I'm seeing them like once a month or once every 6 weeks just to help create more adaptability in the system. But generally, I would say overall to get to the point where they could go out and be like, I've had success, this is amazing, I would say anywhere between 12 to 24 visits.
And then Heidi and Leslie, are you kind of, because you're working in tandem, so is that kind of like your expectations too, is about that same time frame?
Yeah, it depends on the, children are a little different. There might be periods where we stop treatment for a little bit and allow some growth and development, or if we're going into some type of device for expansion or whatnot. And then our adults, and I do a program, like we have a set program. And the reason is because what Dr. Andrea just said, sometimes patients feel better and they're like, okay, like I'm done. So with my adults, I don't do a per session. It's a program that you're kind of committing to, and that can be anywhere from 9 to 12 months.
I would agree with that. Treatment is such a variable thing because each person, while some of these things are all kind of common in humans in general, everybody's circumstances are so different. So their ability to be able to complete the program the way that we've suggested that it be completed, or other outside factors that come in, or challenges that may come up unexpectedly, it can definitely change so even what I recommend in the beginning may change as we go along, depending on those circumstances that come up.
Yeah, for sure.
Yeah, I would say that too. Like we have mentioned before too, with like the program for myofunctional therapy, like we try to really individualize that too. And so there'll be times, like Heidi was mentioning with kids, I think that they could benefit from going into expansion or something else. And we realize that we're not trying to make it so you have 5 different appointments a week to kind of manage all of these different things too, right? Sometimes you need to prioritize different things and take a break from something to focus on something else to see better results with what we're doing too. And it's really having an understanding of when it's time to say, time out, we need to look at, something else, a piece of this picture a little differently or something like that too. So everyone's variable of time can kind of be different depending upon those different circumstances.
Man, I tell you what, time goes by way too fast on these ones. I'm so grateful for your time today. One thing I do want to cover before we end this, though, is the resources that you have for both like parents like myself, but also clinicians like myself. What are you guys offering as far as your programs and things?
Yeah, so we have a couple of different things. You can do one-on-one therapy with us, and I treat patients, and I know Leslie does too, all over the country. Telehealth is an amazing thing, and I think COVID kind of really took us to a different level of being able to treat. And so we do one-on-one therapies. We are going to start offering group sessions at one point. We've talked about that with people in our study group, and everyone has really expressed some interest in helping with that, meaning that, Dr. Andrea might do a presentation and have the group be able to ask questions to a chiropractor. We might have an ENT come on one time. And again, we're trying to get these so people who want to work one-on-one with the therapist can, and if that's their price point, and that's good. But we also want to have other options. The group sessions will be a little bit more affordable. But as we mentioned before, I think that we have a program that you can do. It's a self-guided online video program. I feel like it's the first of its kind that's in depth. We have over 80 videos. It'll be on Kajabi, which will be a online platform, and you'll do the sessions at home at a self-guided pace. We'll send you a little Myo kit that when you open the box up, it'll have a mirror on it, and we'll have all the tools that you need so you can keep everything in one place, and a little travel kit. We have some clients that do travel a lot and they bring it with them. And this will, I think we talked about Andrea yesterday, offline, everyone's lives are so crazy busy right now. And especially if you're doing this with kids and, trying to get kids to appointments or just fitting it into your, busy schedule, this will be something that you can do in the comfort of your home and at the pace that you want. And you can just watch a video with your kid and practice, that video. Or if you're an adult, you can kind of, again, go at your own pace. So that will be available coming soon too.
That's awesome. Yeah, and I'm just brick and mortar, so because chiropractic is hands-on. So I am just I'm in Westbrook, Maine, so right outside of Portland, Maine is where I practice. But there's a huge network if anybody's interested in what I've talked about and the way this kind of chiropractic works, or this technique in chiropractic works, that I can refer them to people across the country that do this kind of chiropractic, so they could find a practitioner in their area. I'm here as a resource because I would love to see everybody under chiropractic care. So,
and what's good contact information for everyone?
Yes. So for Heidi and I with Myo2 Health, that's the name of our business, so you can go to myo2health.com. You can also reach us at our info@myo2health.com, or individually to us as well. We have Heidi at myo2health.com and Leslie at myo2health.com. We're trying to get better on our social media accounts. So we have our Instagram account, and going to continue to keep working on that too. So you can always check us out there. But for now, those are kind of where you can reach us, and always, we'll keep things updated to learn more as the programs get developed.
And my website is Synaptic, SYNAPTICDC, synapticdc.com. And that is my website. And that has all the links, and all of my contact information is right on there.
I love it. Thank you all so much for being here. Have a good rest of your day.
Thank you.
Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.